Your take on what we just heard there from Ontario, what people need to sort of understand with those numbers, those projections.
Yeah, so I think we knew even at the end of wave two that we were going to have a wave three, particularly with the new variants and as things are opening up. So this doesn't surprise me. But what I want to tell people is when we've heard these projections before, and I just heard you saying, but it was, we didn't hit those projections. That's because we actually did something about it. So we shut down, we did the stay-at-home orders, and that's why we never reached what the projections were. When Steiny Brown is making these projections, it's if we keep things as is. We will change things as the numbers go up. And also the other thing right now that is a variable are the vaccines and the role of the vaccines. So it's a bit of an unknown too, because we have the vaccine supply issue. We don't know how fast we can get vaccines into people's arms. So there's still a lot of questions going on right now, but it is a concern with these rising numbers, and in particular what we're starting to see in the hospital as well.
And so people will look at some of those projections and say, well, gosh, why are we opening up then?
That's a very good question. I agree.
And so do you think that, Toronto in a gray zone now, much of the rest of the province either in gray or in red, in some cases even orange as well, too much too soon because of these variants? I mean, it's very difficult to sort of understand because there's so many variables.
100%. I mean, it's very difficult. I think the framework is, some of us might think it's a little problematic. I think certain things are totally fine to be open within what we call gray zone, and other things aren't. Do I think malls should be open? No. Do I think your local small stores could be open safely? Absolutely. So I've never been a fan of this particular framework. I do think that there are small businesses like your local stores where there's only one or two people coming in at a time that have been doing a great job and are safe to be open. But I don't think that these big box stores that have tons of people coming in, or malls that have less control in the hallways, are things that should be open. So that's where the challenge is. It starts with the actual framework and this color framework.
All right, let me ask you as well about today, which is, 1 year to the day since the WHO declared a global pandemic. And, you have seen this every day in your practice, what you do for a living as an emergency room doctor. And what's going through your mind today, Lisa?
I mean, I can't believe that it's been a year. It's so busy right now with the vaccine rollout that it just crept on me. But it's been a long year. We've seen a lot. I've seen, I think, more in the last year than I have in my entire career. And we just have to sit back and think about everything that has happened, both sad and both good. I mean, the sad is that we've had a lot of severe illnesses, a lot of deaths, a lot of loss, and a lot of personal loss in terms of also like not spending time with family and friends and staying at home, and a lot of people really suffering. But then we've also seen some good in terms of the ability to make all these vaccines within such a short period of time. So it's been quite the year, I have to say.
And, as well, just as, again, somebody who's been through it all, the toll that it's taken on yourself, colleagues of yours. I saw this survey, very interesting, from the Canadian Medical Association, talking about, the hidden costs psychologically for people who are dealing with this every day and are expected to be performing at the top level every day, and sort of, sometimes people forget you're human.
Absolutely. Look, I can tell you now, it's hard for so many reasons. I could see it in a lot of my colleagues' eyes. People are tired. Everybody is working sort of at 200% right now, and have been for the last year. Everyone's trying to step up and do the best that they can, but also we're seeing a lot of tragedy, and it is really difficult. It does take a toll. We have sort of compared it to soldiers in a war, and that's what it does feel like at times too. And also, not being able to spend as much time with our family because we're trying to help out our work, and putting in more shifts and covering people when they're sick or have to quarantine. And now with the vaccine rollout, trying to help here. So it's the juggle. It's been challenging in terms of a work-life balance for most of us. Many of us really try hard to have a good work-life balance. But I would say in the last year, that has been a huge challenge as well. And also, like everybody else, we're not able to see our extended family and our friends. And, we personally, I practice what I preach. And so you've heard me many times say, stay at home, don't go out, don't see people, don't gather. And so I follow what I'm saying. And, I don't get to see my mom or my in laws or my sister or my other relatives or my friends. And it is difficult.
I have one last question for you. This is the anniversary, and I appreciate that, hindsight is 2020. But I remember as the story began to sort of break in January and February, the WHO came under more and more pressure to actually declare a global emergency. And even those in the news business, they were holding news conferences, and there seemed to be a reluctance to do that. And, throughout February, they would hold one of these press conferences, and they still would not declare it. It took until March the 11th. Was that too late? Will we ever know?
Yeah, I think so many people were saying earlier on that it was a pandemic. I'm not quite sure what took so long. I really don't know. I think we were really focused. Personally, we were really focused here, what was going on, and trying to prepare ourselves. Um, I, I don't know if anything would have changed. I'm not sure. I don't know the answer to that. I think it had already, was out there. I think it may have even been out there before we knew, there's been a lot of talk that it was around November, December. So I'm not sure if anything would have been different, to be honest with you.
Dr. Lisa Salamon joining us from Toronto. Thank you so much for taking the time and being part of our coverage on this one-year anniversary, Lisa. Really appreciate it.